My name is Andy Davis. I'm a family practice physician in Montgomery, Texas. And about 2.5, almost 3 years ago now, I had a stroke, hemorrhagic stroke on my right putamen, my brain, which affected my left side. So I'm totally paralyzed on my left arm and leg. And I was in rehab for about 3 months after my stroke. And that's where my saga with my UTI began. I did have a catheter initially, and so then I began having recurrent UTIs in the hospital and in rehab as well. And so after I was discharged, I thought I would be done with all my infections, but I kept getting recurrent infections even when I was home. And what happened is that over time, the mainly klebsiella bacterium was becoming more resistant to oral antibiotics, and none of the oral antibiotics would be effective against it. So then I began having IV antibiotics. Would be the only thing that would work, and so that's why I still PICC line in, just in case I need it. But I've not had any antibiotics of any kind, oral or IV, since October the 14th of 2020. So it's been that long since I've needed any antibiotics. And I believe the massager and the bladder instillation therapy has made the difference.
Well, that's wonderful. We've been waiting many years to hear that result because we proposed it quite a while ago, but just since the concept was different, it took a while to get traction. And I'm so delighted that Dr. Corey was visionary to suggest it. He's a wonderful, friend and researcher and physician.
Yeah, he is. He said, I have something that I think may actually give you better results with the installation of the medication in the bladder. And he explained it to me, and I said, I agree. Sounds logical to me to try that. So every time I do a treatment, we do the massager. Initially, starting out, we would do it for about 2 to 3 minutes at a time, rest, and do it another 3 or 4 times during the hour-long treatment of the insulation. I would hold the medicine in the bladder for about an hour. And so during that time period, I would use the massager. So now I'm up to using the massager up to 20 minutes at a time to 30 minutes.
Wow.
So I think that's really helped as well.
Well, had you not applied the massager with the technique, the bladder irrigation, which I haven't met Dr. Lotz yet, but I'm real looking forward to meeting him in the future with that technique. Do you think, based on your past history, that the bladder infection would have gone away, or what are your thoughts on that as far as the difference in the percussive massage that the device used?
Well, initially when I started using the massager, because I began noticing a lot of biofilm coming out in my urine after the treatment. So I think that really helped to unroof the bacteria that was encased in the biofilm, and I think that really did help get rid of the infection. I'm no longer symptomatic, so since October I've not needed any antibiotics whatsoever, and I think that's using the massager with the irrigation has made the difference.
Well, what are your thoughts as a physician as far as the theory of applying deep tissue percussive stimulation to increase interaction of therapeutic agents as well as potentially breaking up biofilm? It's very interesting. You mentioned that you saw originally a biofilm material coming out. Had that happened previously with the irrigation, or was that the first time?
No, only when we used the, because I started the irrigation before the percussion device, and that never happened until after I started using the massager.
Really? Well, that's holds true to what our theory was. So thank you for that observation. That's very interesting. As far as increasing the interaction of any kind of therapeutic agent with a biofilm or potentially disrupting biofilm, does that make sense to you? I mean, obviously you've seen and are describing exactly what we would expect, but do you think that would work in a wider setting in most cases, or what?
I think it would. In my case, I've had such chronic infections that I think the bacteria and maybe even encased itself into the bladder wall itself. Not only just around biofilm, but I think maybe in the bladder wall. And I've had, my history is rather complicated because even as a child, I was born with a hypospadias. And I've had, I would say 10, 12 surgeries as a small child, 4, 5, 6 years of age. So, and I've had probably 10 to 12 surgeries to repair the hypospadias, which included, long-term use of catheters. I even had a bladder stone. They were so large they had to go in surgery to remove the bladder stone when I was about 14 years old. So really, the bladder has been through a lot of trauma surgically, as well as through a lot of catheterizations over my entire life, pretty much.
Gotcha.
So I think there's some structural issues that are at play here that I think the massages made a big difference to kind of help me to be able to deal with the infection better.
But what would you suggest to a patient that has had a similar challenge as far as talking to their doctor? Because what we're saying with this is that this is not a treatment or a cure. This is a kind of over-the-counter adjunct that if a doctor or healthcare provider deemed appropriate, they might want to try in conjunction with the other therapies that they're doing. But would you suggest this to other people, or what would your thoughts on that be?
I would say that they would at least give it a trial to see if it does make a difference in their condition. It'd be worth trying for sure.
Gotcha. Well, how long did it take for you to see results from beginning the process to
I would say within a month, I was able to see a marked improvement in not only my bladder wall, as far as being not as sensitive to infections, but also being able to see that even after about 2 weeks after using the massager, most of the biofilm had pretty much been eliminated. I didn't see any more biofilm after that.
As far as physicians, what would you suggest to them if they're just seeing this, or if they're considering this for their patients?
I think when anyone really has been dealing with either chronic or recurrent infections, and this may be a very good adjunct to the therapy for their patients. I think that as we're seeing more more people that are having antibiotic resistance to bacteria, this may really help to kind of eliminate the need for recurrent antibiotics. And what I think, Steve, what's amazing is that adding just that device to the irrigation makes the irrigation even more effective, because when you have recurrent infection or chronic infections like I have in my bladder, anytime you can get more, I guess, agitation into the bladder and into the bladder wall to make it more effective as far deeper into the wall, I think I'm seeing better results. One thing my wife and I have seen, since she's the one that holds the massager, is that she now notices that when I'm doing my therapy, during the irrigation, I would have a lot of bladder spasms. And since we started using the massager over the last, probably since we started in July, I would say, last 4, 5, 6 months, the bladder has not been having as many spasms during the treatment, and it's made the bladder just, I think, more resistant to any irritation from the medication as well.
Really, that's very interesting. But
before, starting out, I was having spasms, very severe bladder spasms during the treatment, where I couldn't even really hold the medicine in my bladder without having to, it would just be expressed out during the spasm. And so now I'm able to hold the entire solution in my bladder for an hour.
Wow, that's so would the spasm be painful, or would it just be a spontaneous contraction that?
No, it'd be painful.
I gotcha. That is very interesting. But if you had to speculate or extrapolate to something like interstitial cystitis, Do you think applying this technique in conjunction with the bladder irrigation might potentially, I know the etiology of that is not always known as far as the cause of it, or it could be multiple things,
No,
but
they really don't know what the cause is. No.
yeah, do you think there might possibly be a benefit to trying this technique with interstitial cystitis?
Yeah, I think it would be a benefit. Yes, sir.
Gotcha. Okay, well, thank you again so much for participating in this and for allowing us to record it and share it with the public and other medical professionals. And I'm just I'm delighted and feel blessed to have met you, and that this could hopefully come to a very positive conclusion where everything is clear.
Me too. Thank you very much, Steve, for developing it and sharing that with Dr. Corey. And he,
Yes,
like,
yeah.
he is willing to think outside the box, because I've been doing another urologist, and they pretty much had given up on me. He said, I really can't help you much, and so Dr. Corey was willing to think outside the box to help treat me for my recurrent infections. And then when he added the massager, I think that was the little piece of the puzzle that I think added more effectiveness to the treatment.
That, yes, we are very happy to have been able to meet Dr. Corey as well. He's been a good friend and fantastic advisor for urology. His knowledge there is just amazing. And also his comment that his main goal was just to add another tool to his tool belt to treat these things, because that had been something that had been a major point of frustration when you have these reoccurring bladder issues and UTIs that just keep coming back, because it's hopefully a way to put an end to that now with a slight add-on to the current treatments. So that's, yes, yeah, thank you, Dr. Corey, if you see this. And I guess we'll just we'll want to follow up with you in the future, Andy. And again, just I'm just delighted to meet you in person finally, and we'll just see how things continue to go.
I'll keep you posted as well, Steve.
All right. Well, wonderful.